to that, no pain. But at that point, there's a little pain. And he says, I can go further up, there is pain. Further up, no problem, there is pain. And then he continues the mobility with a lot of restrictions and pain. Right? Okay. Now what would you do as an acupuncturist? You have one acupuncture point in the body. When used, the mobility is brought back to the normal range instantaneously. Immediately, the range is brought back. And also, the pain ceases to exist. The point I'm talking about is stomach 38, Tiako stomach 38. Stomach 38. One point, when used with fairly long needle, as long as 2 chun needle, let's say. Yes. Tiako stomach 38. When you use it in the direction of UB54, Chen Shan UB54, which is in the middle of your gastrocnemius muscles, your bellies and the gastrocnemius. These are the 2 bellies. Okay, how do you locate stomach 38? Yes. You have your index finger to run along the tibia. Yes. Run along the tibia. The moment it comes to a halt. Now this is your inferior border of the tibial tuberosity. Tibial tuberosity, the inferior border of the tibial tuberosity. Right? 1 finger breadth lateral is stomach 36. Su San Li stomach 36. Yes. Stomach 36. Now from stomach 36, you run your finger along, 1 finger breadth lateral is stomach 36, Su San Li. From here, it is 5 chun distal. Stomach 36, Su San Li. 5 chun distal is 6.5 finger breadth. Right? That is 4, 5, 6.5 here. Is stomach 38. Stomach 38. Tiako stomach 38. And that is the point for frozen shoulder. Now you needle that in the direction of UB54, Chen Shan UB54. These are the 2 bellies of your gastrocnemius muscle. Right in the middle you have UB54, Chen Shan. It is not through to through needle, but in that direction, stomach 38, in that direction, you insert the needle as long as 2 chun and you stimulate or induce manual stimulation in order to elicit 30 sensation. The 30 sensation should not be mistaken for pain. Pain is different, 30 sensation is different. You introduce the needle, yes, introduce the needle, thereafter you keep the thumb apart, the 4 fingers together, clench the fingers, yes. Now that is your needle inserted at that point, yeah. You hold the needle between your thumb and the 4 fingers, yes. Adduction. This is adduction or abduction. When you do that, that is your adduction. That is abduction. Yeah. Adduction, abduction. So you adduct the 4 fingers, thumb apart, clench, hold the needles in between. Yes. When the needle is in, you rotate the needle. Rotate the needle. At the same time, inward and outward movement at the wrist to synchronize, yes, simultaneously. You synchronize the wrist movement, at the same time you rotate the needle looking at the patient's face until such time the patient feels the 30 sensation. Now what is 30 sensation? It is not pain. When translated directly into English, it means take T-A-K-E. But it does not imply what it says. What it implies is acupuncture sensation. Acupuncture sensation. So when you introduce the needle and rotate, the patient will feel this sensation, which is numbness, heaviness, soreness, distension. Again, numbness, heaviness, soreness, distension. It could be any one of these sensations, if not multiples of it. It could be numbness and heaviness together, radiating along the meridian. It could be numbness, heaviness, soreness together, radiating along the meridian. It could be soreness and distension along the meridian. Or it also could be along the carpal meridian. Yes. It doesn't have to be only on the meridian on which you have selected the point. It also can be on the carpal meridian. Now let's say you have selected the stomach meridian on which you have Tiago stomach 36, stomach 38, beg your pardon. The sensation can either be on the stomach meridian or the carpal meridian, which is the spleen. So it's prudent that you listen to what patient tells you. When you insert the needle and start stimulating, the patient very often is lost for their vocabulary to tell you what exactly they feel. Why? Because it's a mixture of sensations. Numbness and heaviness together, there is no terminology to use. Heaviness, soreness, distension together, no vocabulary to say. Hence the patient will tell you that they feel a current passing along. Electrical sensation passing. Excellent. Or the patient can say, I feel a kind of a warm sensation passing. Excellent. But the moment the patient says, Doctor, I feel pain, you have introduced the stimulation incorrectly. So remove the needle and reintroduce and start stimulating. Okay. Right. We will talk about frozen shoulder in detail later. So that is the point, when used, will relieve the pain and also re-establish the movement instantaneously. But in doing so, what are you doing? You are negating the language spoken by the body or by the patient's system to educate to you to say, look, there is a problem which is deep-seated, if not deep-rooted, that needs to be addressed to and eliminated. Frozen shoulder is a protective mechanism, as I said, a protective mechanism. It could be a problem which can be more detrimental within if you don't address it. So if you fail to realize that, if you fail to understand the language spoken by the body, the moment you negate and use stomach 38 Tiago, the patient will say, thank you very much, he'll praise you from the bottom of his heart, pay you all what you want, thank you profusely, and say, okay, you're my God, yes, or demigod, you've done miracles, I've been having this pain for months, years, you released it instantaneously. But what have you done? You kill the pain, you address the symptom and symptom alone. The pain can recur, maybe the next day, you're lucky if it recurs the next day. It can recur months later, or perhaps years later. Now what happens if it happens again on another day? The pain is going to be manifesting with much more vengeance and vigorous. Why? Because the root cause has taken gigantic proportion with the passage of time. The root cause which your shoulder in the form of frozen shoulder was trying to indicate to you is that there are multiples of problems that needs to be looked into. To begin with, it could be a problem with the neck, such as cervical spondylosis. It could be a problem with the lung, problem with the apex of your lung. It could be a problem with your heart, ischemic heart disease. It could be raised cholesterol. It could be raised sugar, diabetes, be it mellitus or insipidus. The problems are multifactorial, so it's important for you to engage with your patient in a conversation to try and understand What results in